So smoldering myeloma is a very heterogeneous disease. So it's defined by the presence of a monoclonal component inferior to 3 grams and or plasma cell in the bone marrow between 10 and 60 without any myeloma-related symptomatology. What is the problem? The problem is that it's a heterogeneous disease and the risk of progression to active disease, to symptomatic myeloma, is very different. And so what physicians have to do is to evaluate if the patient with the smoldering they are evaluating is at a low risk, intermediate risk or high risk. And it is very simple and it can be very complicated. But if physicians decide to use, for example, the Mayo Clinic model, this model is very simple because it includes the size of the monoclonal component, the plasma cell bone marrow infiltration, and the serum free light chain ratio. And with these 3 parameters available in all smoldering myeloma patients, physicians can give to their patients a very useful information. If they are at low risk of progression to myeloma, the message has to be relaxed, be quiet, because the risk of progression is very low and you need only an hemogram biochemistry and serum protein electrophoresis once per year. If the patient is at intermediate risk, at the beginning probably these assessments have to be evaluated twice per year, but if in 1 or 2 years the disease is stable, so they can be followed just once per year. And if the patient is at high risk of progression to myeloma, the message is completely different because the follow-up has to be closed, and probably this patient have to be followed every 2 or every 3 months with hemogram biochemistry, serum protein electrophoresis, and to alert to the patients that in case of any symptomatology, any bone pain, they have to go to the hospital immediately. In addition, for this high-risk smoldering myeloma patient, I think that in the near future we will offer them an early treatment, as oncologists are doing with many tumors, many solid tumors. Why? Because in the setting of a Spanish myeloma group, we conducted a trial focused on early treatment in these high-risk smoldering myeloma patients, and we have observed a significant benefit, not only in terms of time to progression to myeloma, that it's really relevant, but also in terms of overall survival. So when patients receive the early treatment, their survival is going to be longer. I think that this is a proof of concept to offer early treatment for high-risk smoldering myeloma, but also physicians have to know that there is not any approved drug for this specific disease. So my recommendation would be to include patients in clinical trials because it's the best way to know better the disease. And I can envision in the future probably more than early treatment for high-risk smoldering, these high-risk smoldering patients have to be considered as myeloma, and this patient would benefit of systemic therapy as the rest of symptomatic myeloma patients, but I think that they will obtain a significant benefit and a better benefit than symptomatic myeloma patients.